Hello there, my name is Anne, I'm from Zevo Health, and I want to talk to you today about something that pertains to this time of year that we're in at the moment. There's a lot of change at the moment, changing of the seasons, the weather is changing, the mornings are getting darker and the evenings are getting darker earlier. And this is the time of year where a particular form of depression can occur in some people, and it's called Seasonal Affective Disorder, also known as SAD. So this is something that affects 1 in 15 people in Ireland in their lives, and this can happen between September and November. It can happen later in the year between spring and summer, but it's actually more common between autumn and winter. So this is something that can be more extreme for other people, more severe, and it can be mild in other cases as well. Now, of course, all of us get the feeling of being down, having no energy, and feel like some days are tough. But really, when something like SAD occurs, it can be relentless, it can feel out of character, and it really is something that needs to be addressed. So there are various reasons why SAD affects people. As you can probably guess, they all link back to the connection between the body and sunlight. So when the clocks go back, the sun rises later in the morning and the evenings are darker quicker. There's less sunlight for a number of months, and this can affect your circadian rhythm, otherwise known as your body clock. So it can be difficult for those who travel to work in the dark and also come home in the dark. Sunlight provides vitamin D, known as the sunshine vitamin, and vitamin D has been known to prevent or ease depression. So when there is less available, it can affect levels of depression. When there is less sunlight, there's also a decrease in serotonin, which can affect levels of depression. Sunlight also provides melatonin, which is connected to healthy sleeping patterns. And SAD tends to affect more women than men and more younger adults than older adults. It's actually common for those between 18 and 30 more so. So symptoms of SAD include a general low feeling low in energy, feeling tired, a dip in concentration, changes in sleeping patterns, changes in appetite and weight, a general loss of joy for things that may otherwise give you joy or comfort. Sometimes you can become irritable, you can find that it affects your self-worth, your self-esteem, and it can affect your levels of hope as well. So SAD, because it is a form of depression, it can affect somebody's enjoyment of their work. If they previously thrived on achieving goals, reaching job satisfaction, if they really found themselves interacting with their colleagues, SAD can take this away from them so they don't feel like they get a good job done. So as I'd said previously, some of the symptoms of SAD are low levels of energy, feeling lethargic, and dip in concentration levels. So it's no wonder that this would have a knock-on effect on somebody's working routine, whether they like to get into a good rhythm throughout the day, whether they find themselves to be productive at certain points of the day, or whether they really like to eliminate procrastination. It's obvious that SAD can have an effect on that, and it can feel like they are knocked out of their busy routine and concentration levels can decrease. SAD can have an effect on somebody's self-worth and self-esteem as well. So this can have an effect on how they view themselves within the working environment, and a much bigger picture, how they value themselves as part of the team. So many symptoms of SAD can affect somebody's ability to interact and connect with people in their workplace. If they're suffering from low energy and tiredness, this is going to hinder their chances of being able to connect and bond with people that they work with. Concentration levels, if they're dipped, this is going to hinder their chances of actually being able to hold conversations with people, let alone bonding and connecting. And of course, irritability, if they're more irritable than normal, their tolerance levels and their patience levels are going to be way down, so they're not going to be able to deal with people in the same way they would have done previously. So linking back to my previous point about levels of self-esteem and self-worth, if somebody is suffering in these areas, they're not going to have the same confidence to interact with people as they would have done previously. So this is going to affect social connection. So there are a number of reasons why it's important for employers to acknowledge the effect of SAD. Acknowledging the issue and taking steps to support those who are suffering from it can promote the importance of employee well-being. By flagging that this is a real issue and it's something that you're interested in tackling, this makes it clear to staff that their mental health is an important part of the organisation. This kind of acknowledgement and willingness to help can assist staff in a couple of ways. It provides a foundation for them to rely on with regard to their emotional well-being, which takes the strain off them. So if they think that they can release the valve a bit, that they don't need to take on this issue themselves with no outside help, this can really provide a sense of solace. And the feeling of being appreciated, encouraged and supported can do wonders for self-esteem, self-worth, and in turn it provides a boost for confidence. This can help staff to interact better with others, it can help creativity, and it helps to provide a happier, safer and more rewarding working experience. There are a number of ways to support employees with regard to SAD and with regard to practical support. Is there an option in your workplace to organise a floating desk situation whereby some employees who are suffering with SAD can move towards windows where they can get natural light, maybe they can move towards exits where they can get out for short breaks? You can install something that's called a light box or a light lamp. These are things, they're small, they can fit on a desk, they're easy to access in any shop. They cost about €40 and it's something that emits a replacement for natural sunlight that can increase levels of serotonin and can really help people suffering from SAD. Is there an opportunity to provide alternative working hours, maybe flexi time for some staff that need it? Maybe some people need a later start or an earlier finish, whether that means they can get out into sunlight, into the outdoors, maintain social connections, anything that can help the symptoms of SAD and really ease the depression. Also, is there any way that staff can work remotely, that way that they can set up their own routine in the day where they can do what they need to do to ease the symptoms that they're going through at this time of the year? If people do need to be in the office, is there any way of creating some more options such as a walking meeting? This can create change of scenery that can boost creativity, some gentle exercise and some fresh air and sunlight. So there are many ways that you can support staff emotionally as well. Is there any option for providing an employee assistance program whereby there can be one-to-ones set up with somebody who's trained professionally? Maybe something can be done in a group setting. And the main reason behind these is to really create awareness around topics like SAD and to really create education and information and to take the stigma out of these things as well and to let people know that what they're going through is normal and there can be something done about it. The Employee Assistance Programme can also provide a point of contact that people can turn towards if they have any questions around what they're going through. And also there's an added bonus of discretion and confidentiality. If someone doesn't feel comfortable about opening up in a group setting, they can always turn to somebody in a private manner. There's also many programs that can be set up in-house to support your staff on a social level. Is there any way of setting up an exercise regime, whether that be maybe a five-a-side team or maybe it's a running club or outdoor yoga, weather dependent obviously. But this is something that can really bring people outdoors, create a situation where they're getting fresh air, sunlight, exercise, and there's also the added bonus of the social connection between staff. Also, is there any option to provide outdoor social events for staff? Now, these don't all have to be pub-based, of course. Anything that gets the heart rate going, provides exercise and fresh air and sunlight for staff can really benefit symptoms of SAD. Can you encourage staff to take regular breaks from the desk? Not only does this help their emotional well-being, but it shows that you appreciate them and you care about their mental health. Obviously dependent on deadlines throughout the year, but is there an option to encourage people who are suffering from SAD to take annual leave throughout these times of the year? Really, they can shut down completely and recharge, and this bolsters them for the year ahead. So with regard to SAD, it's really important to address it and acknowledge it, and let staff know that you're concerned about their mental health and you're willing to take steps to help them on their journey. So thank you very much for tuning in. It's Anne from Zevo Health.